The UHN Discharge Summary application is made up of 6 tabs: Visit Encounter, Diagnosis, Course While in Hospital, Alert Indicators, Medications, and Discharge Plan. These tabs align with the Discharge Summary template mandated by the Toronto Central Local Health Integration Network and are used by all hospitals within the LHIN. The Visit or Encounter tab includes the patient's visit information, primary care and most responsible provider information, and contact information for discharge summary recipients. Recipients documented in the patient's EPR face sheet are auto-populated into the Copies to be Sent section. Contact information for any additional recipients added must be checked to ensure they are the intended recipients. Next is the Diagnosis tab. This tab includes the diagnosis most responsible for the patient's course while in hospital, comorbidities or conditions that exist at the time of admission or develop post-admission, and their effect on the patient's length of stay. Information from past visits can be pulled by clicking the Carry Forward Comorbidities from the Previous Visit button.
Information about the patient's history documented in the Sign Out tool can be pulled by pressing the Pull History from Sign Out tool button.
Next is the Course While in Hospital tab. This includes the patient's chief complaints and concerns and a summary of their course while in hospital.
Below this is pertinent laboratory microbiology and other test information. These populate with the most recent result of each result type the first time the discharge summary is loaded. Items must be checked off in order to be included in the discharge summary. Below these are the radiology results. These also pre-populate the first time the discharge summary is loaded. Below this, any other interventions, procedures, or treatments that impact follow-up care can be documented.
Next is the Alert Indicators tab. This includes the patient's allergens and their reactions. EPR is the source of truth for allergies, and all updates must be made in EPR. Allergy information in a particular tab is auto-updated each time the tab is launched. Next is the Medication tab. It is broken out into 7 medication subtabs and will be discussed in a future learning component. The final tab is the Discharge Plan. Patient follow-up instructions to be included in the discharge summary can be documented within this tab under the Follow-up Instructions for Patient heading. Pre-populated follow-up instructions can be selected and further modified if needed. The recommended plan to ensure timely and appropriate follow-up care for the patient must be clearly articulated in the Follow-up Plan Recommended for Receiving Providers section. All appointments and referrals to ensure timely follow-up care must be documented in the Appointments and Referrals section with clear indication of the status. Status options are Booked, Patient to be called, or Patient to call.